Hello there, I'm Dr. Blab, and welcome to my clinic. Before we get started with any tests, first I want to just ask you a few questions to help me better understand your medical history and current health status. Just make yourself comfortable and we'll get started. Can you tell me your full name first and last? Date of birth? Have you ever had any medical conditions or surgeries? Are you currently taking medication? Do you have any allergies or intolerances? Do you smoke or drink alcohol? How would you rate your current stress levels? And are you experiencing any pain or discomfort? Good, thank you for answering my questions. Based on your answers today, I think what we're going to do is conduct a cranial nerve exam, just to kind of run a few tests, get a little bit of a general understanding. So first, we're going to just test your vision. So what I want you to do is cover one of your eyes and try and read along to the letters that I point out. So we'll start easy and just P, good. L, E, A, S, E, very good. We'll go a little more difficult. So R, N, K, S, I, P, D. Can you read line 4? IKEA. IKEA. Very good. Now what I want you to do now is just cover the other eye, and we're going to just repeat this test. So, again, we'll start out easy. So, P, L, E, A, S, E. Very good. B, R, C, E, I, A, K, D, U, R, B, E. Perfect. Can you read the whole thing for me out loud? Please. Like, A-N-D, and S-U-B, S-C-R-I-P-E, scribe. Yes, it says please like and subscribe. You did perfectly. Good job. Alright, so that concludes our initial vision exam, which you did great on. Next, I'm going to test your eye movements. So what I want you to do is just follow this light here as I move it counterclockwise. Perfect. Beautiful. Now, I switched directions here. Just keep following that light. Great job. What I want you to do now is tell me when you see the light flicker on. Good. Good. Good job. Perfect. You're doing great. Yes. Good. Good. Now, I want you to tell me when it enters the frame, or when it enters your frame of vision. Good job. Perfect. Beautiful. There you go. Nice. Nice. Good job. Now the last kind of eye tracing, eye tracking test we're going to do, I want you to just follow the light as it goes between my fingers. So just nice. Good. 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 Now, what I want you to do next is follow the light as it moves between my fingers. So don't look at my hand, but look at the light. Just good. 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 Good job. And perfect. I'm going to just do that with the other hand. So, good. Perfect. Good job. There you go. Over here. Down here. Over here. And right here. And one more. Perfect. You did great. That concludes the visual part of our cranial nerve exam. Next, we're going to test your sense of smell. So what I have here is a little scented candle. I have a couple actually. And I'm going to just ask you to describe for me the smells. It could be a very specific description, or, if you don't know exactly what the scent is, but you can kind of describe what it reminds you of, that also will be sufficient. So our first smell is this green candle here. Just let me know what it smells like. Good. You said mint. That's correct. This is a nice, minty, fresh candle. And so I'm going to do one more candle just to make sure that wasn't a lucky guess on your part. And what does it smell like? If you said lavender, you got it. That's 2 for 2, so your sense of smell is working great. I'm just going to make a note of this really quick. So, vision, good. Smell, good. Eye tracking, good. Alright, next I'm going to just test your facial muscles really quick. So what I want you to do is just give me a nice cheesy smile. Perfect. I want you to frown. Good. Can you just puff out your cheeks for me really quick? Scrunch your face as small as it can go. Like close your eyes, close your mouth tight, just up. Perfect. And now just open it all. Alright, so now that we've done the facial expressions, I want to just test your tongue movement. So just stick your tongue out really quick for me and move it side to side. Good. Good job. Okay, let me just make a note of all that. So, facial muscles, check, and tongue movement, check. You're doing great. Our next test will be testing your sense of touch, and then we'll be testing your sense of taste after. So I'm just going to be getting some gloves on, so don't mind me. thank you for waiting. Alright, so I'm going to just test your sense of touch. So I want you to let me know when you feel this. I'm just going to poke you right on the nose. Just boop. Good. Next, I'm going to use a little jade roller. The ridges are just to kind of gently massage. Don't worry, it doesn't hurt at all. So just chook, 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 chook. Good. I'm gonna do that a couple more times. So just chook, 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 chook. And let me know when you feel this stone. It's just a nice cooling stone for facial massage, so it should feel slightly cold to the touch and stipple. Good. Just going to do that a couple more times, so just stipple. 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 Nice. And I want you to tell me if you can feel this. I'm not going to touch you directly, but what I'm going to do, I'm going to flick some negative energy out. Flick. 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 Good. That will conclude the sense of touch test, so let me just make a note of that. Touch. Check. We're almost done. Right, now I'm going to test your sense of taste. So what I want you to do, just stick your tongue out, close your eyes, and let me know what each thing tastes like. I'm just going to do 3 little food items. So just, I'm going to get really close. I'm going to just touch your tongue and... Alright, can you tell me what that tastes like? Good. Watermelon, you got that correct. Alright. I'm going to do that again, so just close your eyes again and stick out your tongue. I'm just going to press this against your tongue and... Alright, a nice pink frosted donut. Good job. That one's a little bit more complicated of a flavor than just watermelon, so you're doing great. And last but not least, just close your eyes and stick out your tongue for me and... Alright, yes, this is a soft taco. If you want to order any of these for yourself, you can always stop by the cafeteria after our exam. And let me just make a note of this. Alright, sense of taste, check. Alright, let me just look over my notes here really quick, just to make sure we haven't forgotten anything. So let's see. Vision, eye tracking, smell, facial muscles, touch, and taste. Good. Well, that will conclude everything for our cranial nerve exam. Passed with flying colors. I hope you found this experience relaxing and informative. Remember to take care of yourself and stay healthy. And thanks again for visiting my clinic. Take care now.